Hi, my people. It is I, your favorite crazy lady, and welcome back to my podcast, Living Disabled, a Life Worth Living. Before we get started on anything, I do want to preface this the way I normally do when I start my podcast videos, especially for this channel. I am not a healthcare professional. I am not giving you healthcare advice. I am giving you the perspective from of a condition or things that help me from the perspective of a person with chronic illnesses or disabilities. So I'm not a healthcare professional. This is not healthcare advice. My goal with this channel is to, and these podcasts, are to talk about disabilities, making it easier to talk about illnesses, disabilities, the things that we have to go through, and maybe share some things that you didn't realize may help you. This also, I'm hoping, will spur on conversations between us here, so comment below, plus having a conversation with your medical professionals about your diagnosis and your conditions and your treatments, letting you become a better informed person and hopefully becoming healthier from it. So now that we have that covered. So what are we talking about today? So today is April 1st. It is almost 8:30 in the morning on April 1st. I've been up all night. And since it's the first of the month, you know what that means. It's time to refill our meds. So medication. Medication is one of those things that's been very difficult for me over the years. I always thought it was perfectly fine just to take your bottle out every day and take your meds. And what I've learned over the years of having more meds added, other meds taken away, it's becoming harder to remember to take the medication, and if I did and if I didn't, and I don't want to overtake medication, so I can't necessarily count my pills to make sure that I've taken it, because what if I missed another day and I already took it today, but there's an extra one in there from before? And I can't overtake medication because that's harmful, so I would just miss. What do you do? Well, there's many things that many people do, and I've tried using those big clunky pill organizers that are AM, afternoon, nighttime, bleh. They don't work for me. They really, I don't like using them. I find them cumbersome, and it's just a pain in the ass. And what do you do if you have refrigerated medication? Because a lot of this started with the fact that I had a medication that had to be put in the refrigerator. But then when I put it in the refrigerator, it would get moved. And you can't put it to the back of the refrigerator because it could freeze and the vial could break. But then you can't put it in the door because the door is opened way too much and it can become warm. And then if it's in the way from what the girls want to put there, they'll just move it. And then I don't know if I've taken it. I don't know if I have it. It became a big issue. So I spent $50 and bought a mini fridge. It is right there next to my bed. I have a bunch of stuff piled, so I'm not going to show you because y'all be judgy. Everybody on the internet be judgy and, wanting to put people down because they do things different or they don't do things the way you want them to do. And this pillow behind me is driving me freaking insane. All right, you're going away. I can't handle it anymore. It's going over there. Now I have nothing behind my back. Excuse me a moment. See if that's a little bit better. Okay, I think we can get through the video that way. So it just became like a huge issue with medication. So I got this. It holds. It's got 3 shelves in it. My medication goes on the top shelf, and then I have fruit cups and a couple of other snacks that are in the middle, and then I have drinks on the bottom. It only holds like 4 cans of soda or cans of tea or whatever on the bottom, and that way I know I always have something to drink in here besides my trusty water bottle. Now this particular water bottle I love. They do not carry it anymore at our Walmarts, but I wish they did, because this is spill proof. It is a sports bottle that does not have a pull-up nipple. It has a little diaphragm on the inside. So you have to kind of suck on it and squeeze. You can do just squeeze, but then it usually is like a punch in your face when it hits your mouth, and it's kind of startling. But it's very soft. It's easy to clean. The pink one I use only for water. I have a blue one that I use for tea, and then I have another one that I use for different flavored juices. Why? Because it is plastic. It is not silicone, and flavors get stuck in it. But I love it because I can keep it next to my bed. Doesn't matter if it falls over. It's not gonna leak. So unless I literally physically roll on it, it's not going to do anything. Love that thing. So I was trying to figure out a way to keep all of my pills so that I could see them easily and know if I took them or not. So then I had the idea, because I've already taken my vitamins and stuff and I velcroed them to my wall. So what if I take my pill bottles and I velcro them to my refrigerator? So the front of my refrigerator has these sitting on them, plus my fan remote, my emergency heart medication, and a Tic Tac container that has baby aspirin in it. I like this for baby aspirin because it's easy to get out. If it gets knocked down, it's not going to pop open. And it's really easy to grab and use. If I'm having a heart issue, I can literally just put a couple in my mouth and chew them. So I like that a lot. My emergency heart pills are on a rotary dispenser. This is my actual heart medication. It is not nitroglycerin pills or anything like that. Nitroglycerin needs to be kept in a dark container at all times because it will be affected by the light. So this is actually my metatoprol. It has a flip top on it, and then you can push the button and it will dispense one pill. And that way, if I need help, I'm in severe distress, I can get help with it. And it says on it, emergency heart meds. So if I tell somebody they need to go get my heart meds, they know exactly which one to grab. One of my huge issues was with medications. Knowing if I've taken them, if I haven't taken them, have I, are they in a spot where I can easily get them when I'm thinking about it? If I'm busy when I'm supposed to take them, are they going to be more convenient for me just to remember to do it later? So these actually are velcroed to my refrigerator right next to my bed. I have to stare at this all the time. Anytime I'm in my bed or in this section of my room, I see it. I also have to look at it, look at and lift it up if I want to make sure the temperature on my refrigerator is okay. Oh, excuse me. Baby aspirin went down the wrong way. So I bought these two systems. One is purple and one is blue. This one is for my AM meds, which have to be taken without food, without anything but water. They can't even be taken with juice, because if I do, they will screw up the potency and the way it works, and it'll make me sick. This medication has to be taken an hour before I eat or drink anything other than water, and cannot be around any other kind of medication or it will not work properly. So this one is for in the morning, and then this one is for in the afternoon. Now, the way that I did this, and I got these, I've tried, this was probably my 7th or 8th go round with different pill containers, because they tell us all the time, oh, you need those, the ones that have the multiple hours on it, one big cumbersome thing that does AM, PM, afternoon, nighttime meds, and I found them cumbersome, clunky, and I wouldn't use them. They were hard to refill. They make ones that you can actually flip over and like lift the whole panel off and fill it up, but then they don't come out. You have to literally pick up the whole entire thing and flip it out or try to dig out all of your pills. And for me, that's just not conducive of me taking my medication. So when I saw these, I was like, oh, these are really cool. They're small, they will fit in your pocket if need be. And the one thing that I really liked is they're one hand operational. So last month I did this on the 2nd. So I did take my pills on the 1st, but these ones actually have my pills in them because of the fact that I filled it on the 2nd, and I always just refill the whole thing. So this is my medication for today. And I like doing it this way. That way the on the 1st I know I took my meds, but I also refill it so I can take my meds first thing in the morning before I have a chance to refill my medication. So this is what I do. So these go, which is a little confusing. There is 31 days here. They go 1, 2, well, it goes 1, 2, 3, 4, 5, 6, 7, 8. There's 8 all the way across here. I find that very confusing because it's not an entire week. So when I get down to like Sunday and it's here, I get really confused because it's going to skip a day. Each row is going to adjust for a different day, and I didn't like that. So I found it very hard and confusing to follow. So what I do is I do 1, 2, 3, 4, 5, 6, 7, 8. It's a lot easier to keep track of 4 than it is to keep track of 8. The other thing with these is you notice they have a box with a date on it. They also have a little lip right there. It's hard to open it just by pushing on that lip. It will do it, but it's hard. They're actually made to be squeezed. So what I do is I put them straight up the way they're supposed to be, and that puts that lip down. When I take my medication, I now flip it over and put it lip side up. That also moves where the box is for the date. That way I can easily, at a glance, tell if I've taken my medication that day. Now, when I get to my afternoon meds and I take these, what I do is I swap places, and I swap them upside down. Oops. Like that. That way I know I've taken my entire dose of medication for that day. I can look at this on my refrigerator and go, yep, I've taken it. No worries. But I know if it's in the afternoon and I'm like, wait a minute, it's not switched. I can just feel and be like, oh yeah, I took my meds this morning. It's okay. And then I think, oh, when did I take it? Okay, now I can take this one, and then I swap them. Since I have been doing this system this way, I've done this now for 4 months. This is my 2nd month of taking my meds every single day. I haven't missed a dose of medication in 2 months. So let's refill these and talk about medication. So I have this med bag that I think I paid $4 or $5 for on Timu. It is an insulated bag and it is waterproof. So I can take this out with me and know that I have all my medications with me, and know that even if it's raining, my medications are going to be fine. So what medications do I usually keep in here? I'm going to try not to show you any labels. This is my emergency prednisone. Well, it's not actually prednisone. It's methylprednisone. It's like prednisone on crack. It is an emergency medication for my autoimmune disease. But I keep even if it's something that I don't take on a regular basis, everything is in this bag. Because this way it makes everything in one spot, really easy for me to access. But when I go to my doctor's appointments, I can grab this bag and it will not just have my daily medication, but all the medications that I take, including the over the counter ones. So I have a spinal injury, and one of the things that I have found helps is Dome pills. Now, Dome pills come in a blister pack like this. So what I've done is I've taken an older medicine bottle, taken the label off of it, and then I've put the Dones in the blister pack in it. Now, the one thing that I normally do, which for some reason I didn't on this one, is I will take a permanent marker and I will mark on the lid what it is. Dones pills. I don't know why that wasn't marked on there. But I do this with all of my medications. They are all nicely and neatly put on there. This is my Lipitor, and I take it once a day. Lipitor 1X, once a day. This is my dicocycline. We call them my dick pills because it's DIC is what it starts as. And this is what I use for my digestive issues. I have precancer of my colon, and eating is not always pleasant for me. Even drinking water sometimes can cause extreme abdominal distress. So this one doesn't have how many times to take it, because this is a take when needed. I do this with everything. My cholesterol medication, which I still don't understand why I'm on my cholesterol medication, the Lipitor, because my cholesterol is less than 100 now, which you can go too low. If you go too low in your cholesterol, it actually causes brain and cognitive issues. Now, this one is my thyroid medication, and I take that once a day. This is the one that has to be taken by itself. But I also put in here my heart pills, my Prilosec. This is my pain medication. My generalized pain medication I keep in here. This has my narcotics in it. Plus it has the tramadol and a couple of other things. And then it is marked pain meds. That way, if I'm having a problem and I tell my granddaughter, can you go get my pain meds, please? She knows to open this up and get my pain meds. Now, this was what I was talking about with your nitroglycerin. Nitroglycerin does go bad. So you need to check your expiration dates, but it needs to always be kept in an amber or black container and away from light and water. So I always leave it in a bottle inside of its original bottle. I have deodorant in case I go somewhere, and because I can't smell, in case I go somewhere and somebody's like, yeah, you got a little bit of an issue. So I have that. I have my oxygen meter, my inhaler, my eye drops, and a set of earbuds and phone cord charger. This way everything is kept together. Now, hopefully that did not show, let me see, hold on, any critical information on there. I didn't realize that was flipped around. I think it only basically said what the medication was. Let me see. Yeah, it didn't have my address on it. Okay, thank God. Because y'all be crazy. Not y'all, but you know what I mean. Y'all be crazy. There are people on the internet that are just insane. And we're going to talk about that on the other podcast, different things that we went through. So these are all the medications that I have to know that I have to take. So I'm going to put these back over here for right now because some of these are meds that I don't need to put in my organizer. But this is the most important pill that I take, the levothyroxine. It is a hormone replacement from having my thyroid removed from having precancer of my thyroid. I had 5 tumors on my thyroid that made it hard to even breathe. It was a huge issue. So I'm going to double check these. Yeah, these should all be empty. But I'm going to also make sure that they are facing the right direction. I'm going to open every single one up. And yeah, I don't have the availability to be able to really edit well. So you're getting the whole video unedited. I always say you get me, the good, the bad, and the ugly. I am the ugly. My content is the bad. And some of the information is the good. And that includes the bloopers. So when I'm doing my medications like this, I always make sure to do the entire unit. I'm not going to do the whole, oh, okay, well, 4 days have passed, so I'm not going to do 1 through 4. No, I'm going to do the entire thing, but I will flip those days over so that it makes it look like I've taken them, and I will actually flip them and swap them out so I know not to take them. Now, if I miss a medication, if one day I'm not feeling well, or I've slept a lot, or we've been out somewhere and I've missed my medication, I do not swap its place. I do not flip it over. I do not touch it. I leave it unaltered the way it is. And the reason why I do that is because I want to be able to look at it and be like, oh yeah, I skipped that day. What was going on the 3rd where I skipped that day? Oh, that's right, I was sick. I slept all day because I was vomiting, or I didn't feel well, or I had a migraine. Whatever, I want to be able to hold myself accountable. And by doing this way, it actually helps hold me accountable for taking my meds the way I need to. Now, I don't remember if I said how much this system is. I believe I paid around $8 for this system for each one. Sorry about the light. I don't see well. My eyes are failing me. So excuse me, I have an itch. So what I do is I just take a couple of pills at a time and I put them in, and because there's only one pill in each one of these, I snap it closed right away. I don't want to forget that I've already put that medication in there. I go through the exact same pattern every time. That way, like this time, I had these two, I did 2 at a time. This one I did 3 because I grabbed 3 pills. This one's not done yet. So I know where I need to start again. So now that that row is done, I will put that row down. Then the next 2. And then the next 2 again. I will go down, up, the entire thing. That way I know where I have put medication and where I haven't. That one was a big one. It was 5 at one time. Now, it's important that you take your medication about the same time all of the time. But I was talking to my doctor about this. Because there are times when, because I don't sleep well, my sleep is completely screwed up. And he's like, it doesn't matter as long as you're taking it far enough apart from each other. So I don't want to go through my day and forget to take my meds and then take this medication at 10 o'clock at night and then take it again at 3 o'clock in the morning when I normally take it. Because then I'm going to be having too much of the medication in my system at one time. So it's important that you take it about when you're supposed to take it so that your body has the correct amount of medication in it at one time. It is not something where you need to necessarily worry constantly that if you don't take it, if you're over an hour late taking your medication, be like, oh, I have to miss it for the day. He told me it's more important to make sure you take your medication if it is a medication that is life altering, the way my thyroid medication is. It's more important that you take it than not take it at all. It's the same as if it's 10 o'clock at night and I'm like, oh shit, I forgot to take my thyroid medication that day. I'm not supposed to take it with other medication, but I'm tired and I need to go to sleep. And I know I'm not going to be awake in an hour to be able to take my meds. My doctor told me, and this is strictly what my doctor told me, you ask your own doctor before you making your own decisions on this, but they told me it was better to take it with this medication and take them together so that the medication at least gets in my system. It will not be as potent. It will not be as productive as it needs to be, but at least my numbers will not drop off completely. So there are times when I do take my thyroid medication with the rest of my medication. If I do that, and I have done that when we've been like out or things have went on during the day, or I haven't been home, and I'll come home and I'll take all my meds together because I'm going to bed. And then, I'll do that maybe a couple of times that week, and then I'll notice I'm starting to get cramps in my hands. I'm starting to get muscle aches. I'm starting to get twitches in places that I normally don't have twitches. And I've learned that that is actually a sign that I'm low on my thyroid medication. So then I've had to stop and think, oh, wait a minute, why is my thyroid medication low? Did I do something different this week? Did I change the way I took it? Did I take it and then the girls bring me in some sort of food or something? Lily's really good at that. She does not want to waste food. So she'll be like, hey, Nana, I have half of this. I don't want any more. I know you haven't eaten. Do you want this? I'll be like, sometimes I'll say yeah. Sometimes I say no. It just, it kind of depends. You are not a trash can. You're not. We've had to have this discussion with Lily too. People are not trash cans. But I've had to stop and think, am I taking it right? Am I taking it too late? Am I taking it too early? And by making those simple adjustments helps my medication work better within me. But like I said, that is me. That's the way my medications work for me. All right, so next I'm going to do my afternoon meds, which is all of my other regular meds. This one is my Lipitor. This is the one that we use for cholesterol. And this one I'm perplexed on. And I've talked to my doctor about it. And I'm still on the fence on taking it. I do not have a cholesterol problem. My cholesterol was under 200. The highest my cholesterol got, and my endocrinologist, oh God, it was so funny. My endocrinologist was like, what happened? What happened to your cholesterol? And I was like, why? What is it? And I also get I also get a copy of my results when they come in, so I don't have to wait till I go to the doctor. But I hadn't looked at that time, and I was, oh shit. Well, I fucked up. Just a minute, and I'll explain to you why. I asked, what happened with, what do you mean? What's my cholesterol at? And she's like, your cholesterol jumped almost 100 points in the last 30 days. And I went, oh, yeah, that's my fault. And she was like, what do you mean that's your fault? And I was like, well, I went on a bacon bender. I have an eating disorder, and sometimes eating is difficult. So I was like, the only food that I really could keep down for almost 3 weeks was bacon. So I had bacon sometimes 3 times a day. Now, I didn't have like a half a pound of bacon at a time. I had like 3, maybe 4 strips of bacon on a sandwich or with something or as a snack. But yeah, I had enough bacon to raise my cholesterol. So when my doctor was like, well, your cholesterol is about 200, we're going to put you on Lipitor, cholesterol med. And I was like, but why? It's not high. And he said, because you're at a higher risk. I've had 5 strokes. I have a heart condition. Even though I'm a retired professional chef and I know how to eat and I know the dynamics of eating well and being responsible with the things that I eat, he's like, I still think it would be useful. He's like, let's try it and let's see what happens and we'll go from there. So I agreed, and we have, and now my cholesterol is down to about 100. So I'm not sure if we're going to stay on it, because I do know I talked to my cardiologist, and my cardiologist was like, it's getting down to the point where I'm getting a little concerned. He goes, if it goes below 70, we need to remove you immediately. And I'm like, I got it. I got this. So I said I screwed up. Do you notice what I did? This has several medications that need to go in it. So, not paying attention because I am talking to y'all, I closed the lids, which would normally be the thing that you should do, but not when you still have medication to put in each one, because it's ridiculous to have to sit here and go through each one and have to open it up each time. That's ridiculous. Okay, so to keep track of my medication, because this is another point of contention for myself. I used to take care of my dad, and I used to do my dad's pills. It gets confusing when you have various different medications that you need to take. Did you put this pill in? Have you done this one yet? What haven't you done? I leave all of my pills in my bag. As I take out a medication, this one's my metoprolol for my heart condition. It is also my emergency heart medication. I will take it out of the bag, and as I get done with it, I will put it outside of the bag and not put it back in. That way I know when I've transferred the medicine that has to be put in here and it is no longer in the bag, I know I am done. All right. So, the other thing with medications, I think you need to be aware of what your medication is for. See, now that I'm doing these ones, I'm trying to keep an eye on it until I go down the entire row of 4. Once I get done with the row of 4, I'm okay. Now, if it's a situation where you have to take a break a minute and you're not sure and you need to walk away and you go to the bathroom or whatever, and you don't have to worry about animals like screwing things up, at the very bottom of the one that you just filled, click that one. Close that one like this, close it, so I know when I come back I need to start at this one. Don't stop in the middle of a row. I don't have to go and search and try to figure out, oh, which one is next or any of that. I know exactly where I need to start. I know exactly where I stopped. And it doesn't matter if I come back to this in 5 minutes, 50 minutes, or 4 hours. It's all going to be the same. Last one for this pill. Now, the thing that I like about doing this way, putting the beginning, at least, because this is metoprolol, it's not going to fit all the way on the lid. So I just have Met 1X once a day. Now, since I have this out, I'm going to push this aside a minute. I'm going to grab my emergency medication. I know there should be a couple of these that are empty. Okay, I only have 2 that are empty. These 2 here are the ones that I used this month. So I am going to click it over until I hit an empty spot. I'm going to lift up the lid and I'm going to put a pill in. I'm going to close the lid because this makes the pills jump. Push the button. Refill, that's done. Now that I know that that is done, I will put these down beside the bag and I know that both of my emergency medication and my regular medication is done. I'm not going to sit and have to worry about, oh, did I do my emergency meds? Are they filled? I don't have to go back through and try to dig these out. It's all like right here. Everything is right here and it's super convenient. The don'ts is a no. Excuse me. I also take Lasix. Now talk to your doctor because this says Lasix 1X. I get, how many pills? Is it 30 pills? Yeah, because this is for 3 months. So I get 30 pills a month. The thing of it is I cannot take Lasix every day. If I take it every day, it doesn't work. I can't take a 20 milligram pill either. Talk to your doctor and figure out what works for you. I've been seeing my cardiologist now for 15, 17 years, something like that. He also knows how I operate, how my brain works, and that I over-research everything due to medical neglect. So he will sit and listen to me, and we will have a conversation. When we decided that I needed to be put back onto a diuretic, because I was using medical marijuana as a diuretic. It is an awesome diuretic, but you have to make sure you use the right strains. Due to some surgeries and stuff, I had to stop taking my medical marijuana for a while, so I did not have a diuretic. I started having issues, not congestive heart issues, which you can, but with my leg and stuff swelling from my lymphatic problem. So I ended up in the emergency room. They gave me 80 milligrams. This is 20. And it relieved a lot of the liquid at one time. They put me on it on an everyday situation, and it doesn't work well for me. When you take a diuretic, the other thing that you need to be aware of is that it will lower your blood pressure, or it can increase your blood pressure. Your blood pressure is dictated by the blood in your system, which can either be thick or thin or sticky, and all of those things will involve and fluctuate your blood pressure as well as your heartbeat. Now, if I take Lasix, I have to watch my blood pressure tremendously, because it reduces the electrolytes in your body, which reduces the way your heart works. So you have to be aware that your heart is operating okay when you're taking a diuretic. Now, because the 120 milligram pill of Lasix does not work for me, my doctor and I have talked about it, and we have come up with a plan, because I only take it when I need to take it. Otherwise, it messes with my heart too much. I am allowed to take up to 4 of these. I am allowed to take up to 80 milligrams at one time. And I know a lot of people are gonna be like, but that's not this is what my doctor and I prescribed for me to do, decided for me to do. I'm not giving you any advice, and I'm not telling you should do this. I am telling you that you need to talk to your doctor and find out the best way for your medications to work for you. Normally, I will take 40 milligrams and I will see how it goes. Now, the reason why it's called Lasix is because it only lasts 6 hours. That is actually the reason why it's called Lasix, because it lasts 6 hours. For me, it is not an immediate response unless it is an extremely high, like 80 milligram dose. I have been given in the hospital up to 120 milligrams, but that was in an emergency situation. Do not take anywhere near that at home unless your doctor tells you to. Seriously, you can cause a heart attack by taking diuretics. What I do when I'm going to take Lasix is I take it before I go to sleep. I take it before I go to bed, because I only sleep about 4 to 5 hours at a time. And I know the Lasix is not going to kick in my body for at least 3 to 4 hours, at least. And it's going to last throughout most of the day. I have a very small bladder. So once it starts working, it works very well. So what I do is I take 40 milligrams, I go to sleep. I usually wake up needing to go to the bathroom, and then I can go back to sleep again. Wake up a few hours later, repeat, and then as I'm up that day, I will start going to the bathroom more and more. If I feel like it is not enough, I will take another 20 milligram dose. I will not exceed 80 milligrams in one day, because that's just asking for trouble. You're going to start depleting enough electrolytes that you're going to start having a problem. The other thing with taking a diuretic is you need to keep something like buoy. This is not an advertisement in any way, shape, or form. Buoy electrolytes that are specifically designed for people with health issues to add to their food or their drink to restore their electrolyte balance, using deep sea mineral salts. It is one of those things that you need to make sure that your heart is working properly, and the best way to make sure if you're having a problem in your regular heartbeat, an accelerated heart rate, cramping, and that is to take an electrolyte. If you are having an emergency situation, you can just eat salt. It is the easiest and the fastest way to restore your electrolytes in your system. Take a pinch of salt, sea salt, iodized table salt. It doesn't matter. Salt in this situation is salt. Take it and you'll feel better. All right. So this is my omeprazole or my Prilosec. One of the problems that I have, which is a birth defect on my defectiveness, none of the sphincters in my body work properly. You have hundreds of sphincters in your body. Most people only think of one. They only think of your butthole. But that's only one sphincter in your body. When you're talking about a sphincter, it is talking about that squeeze shut valve. The one that goes like this. You have them in your veins. You have them in your arteries. You have them in your heart. You have them in your throat. It is actually what closes off your throat when you are eating and digesting food, so that it doesn't back up into your system. Mine do not work. So I have to take this to keep stuff from coming back up into my throat and burning my throat. Now I've been talking, so I haven't been paying attention to what all is in here. And I think that's it. We are done. Yep, we're done. I have looked through the bag and there was nothing else in there. So before I put my medications away, itchies. Before I put my medications back into the box, I just want to make sure that these are all closed, because I will be devastated and heartbroken if the dog jumped up here, the cat jumped up here, I moved, something got bumped, and this fell over, and I had to find all of the pills, and I had to figure out which ones went where. I would end up dumping them all back out, separating them, and going through the whole thing again. And then that way I would know if I had all of the medications and I picked them all up. And then I have to worry about, oh my God, what if the animals get them? What if? And we don't need to what if. I'm on a lot less medication than I used to be on. I think medications are a great tool, but I think they are just that. They are a tool. I think you need to understand what your medications are, what they do, what the side effects from your medications can be. I was misdiagnosed years ago where I was misdiagnosed with one condition, one medical condition. And now that I know this is zipped up, I know I'm completely done. I can put this onto the spot on my refrigerator, give it a little jiggle to make sure the Velcro caught, and we're done. I was misdiagnosed years ago, and I was put on medication for that misdiagnosis. That medication had side effects. They didn't realize that the medication that I was on I didn't need, so the side effects that I was having were side effects. They looked at it as, oh, well, now that we've taken care of this condition, she's now developed this condition. So then they gave me medication for that, which developed side effects, and then instead of seeing it as a side effect, they saw it as a condition and gave me more medication. At one point in my life, I was on 13 different medications that I did not need to be on, strictly off of the case that I was misdiagnosed once, and then every time I had a side effect, it was misdiagnosed as another condition, and it snowballed from there. 13 medications. That is a lot. I ended up in the hospital being overdosed by one of the medications because it was not working the way the doctor thought they wanted it to work. So instead of being like, okay, why isn't it working? She just kept increasing the dosage, and she ended up putting me on a higher dose than what legally they were allowed to put me on. This was a very long time ago. And I got up one morning, I stood up, and I fell down and passed out. I had to be taken out to a pickup truck and taken to our nearest emergency room, which was 45 minutes away. They were telling us that it was going to take about an hour to get an EMT to me, so my father was like, nope, picked me up, put me in the truck, and drove me to the emergency room. They did have a hearing with the doctor that OD'd me, and even though my prescription that the pharmacy had verified was in the amount that was on the bottle, it was taken the way it was supposed to be taken, even though it was higher than the legally allotted amount, she said that I was abusing the medication, so nothing happened to her over it. Even though it was completely documented that, this is what she had done. This is what she had requested. You need to be very, very cautious of your medications. Know what they are, know what the common side effects are, and look up to see what your rare side effects are. I had a pain medication that was a topical for my knees. Worked amazing. Took like 80% of my pain away. I was delighted. After being on it for a week and a half, I started getting crippling, debilitating migraines, and I could not see. They were telling me that I was having blackout migraines. They wanted to do Botox into my temples to stop the pain and the blackouts. My insurance would not approve it, so I started doing some looking to figure out what exactly this was and what I could do, and what I found out was there was a rare side effect from the pain lotion, the pain ointment that they had given me, it is extremely rare, but it does happen where it causes these types of migraines. When I asked the pain clinic about it, they're like, oh, that's probably not what's going on because it is super, super rare. And the one thing that, well, like my orthopedist says, if it's a rare condition and it's a rare side effect, she's gonna get it. After I stopped the medication and my body had to detox for about a week, the headaches went away. Never had them again. It was all because of the medication. It is your body. It is your responsibility to understand how your medication works. What are the side effects? What are the rare side effects? Does it interact with other medication? There is a PTSD medication that is used primarily for people with PTSD and night terrors. My psychiatrist, when I was going through my TMS therapy, that was overseeing that, she was like, yeah, I want to put you on these because you're having a lot of night terrors and stuff. And I'm like, okay. I got the medication, I brought it home, I looked it up and found out that I couldn't take it because it would have a fatal interaction with my heart condition. I called my doctor and she goes, well, I asked you if you have high blood pressure and you told me no. I said, I don't have high blood pressure. I don't. This was a situation where the doctor asked the wrong questions. I was like, have you went onto the manufacturer's website and looked at the list of questions you're supposed to ask people before you prescribe this? And she goes, well, I'm going by what the rep tells me. The rep tells me what we're supposed to act and what we're supposed to do. And I'm like, well, that's on you. Because if you go to the manufacturer's website, it specifically tells you do not use this if somebody has these types of heart conditions. You need to ask these questions. The fourth question down is, do they have high blood pressure? The number one question is, do you have a known heart condition? Second one, do you have a heart defect? I was never asked those, because then I would have answered the question the way she asked it. Doctors get mad at us when we give them too much information, but we have to learn to know when they're not asking the right questions. It is up to you to know the way your medication works, how it's going to interfere or interact with your body, if it's going to interfere with anything, and the things that you can expect from it. It is also up to you to decide how you're going to use your medication, when you're going to take it, all under the advisory of your doctor. You cannot always expect your doctor or a pharmacist to know proper medication, the proper way to take it, or the interactions and precautions that you need to know. You cannot count on it. I had one medication that I was prescribed a couple of years ago, and doctor never asked me any questions. I got it from the pharmacist. The pharmacist never asked me any questions. Brand new medication. I was already on 5 medications at that time. I got home and I looked up the medication on my my Walgreens app, and there was a yellow marker next to it, and I was like, what does that mean? So I clicked on it, and unfortunately Walgreens doesn't do this anymore, but it said potential interaction and it gave the medications. I called the pharmacist and I was like, hey, did you know? And he's like, oh, well, we get those. I was like, does this pop up on your side? And he's like, well, yeah, we get that, but we only pay attention to it if it's red. Why? It's still an interaction. It's still a potential problem. It's your responsibility. It's our perception that you are taking the responsibility of making sure that we're okay. And what I have learned is you can't take that. Okay, meds are refilled for the month. We've talked about our medications. Hopefully somebody will find this useful and informative. And until we meet again, it's just my 2 cents. Take what you want, leave the rest. And until we meet again, and hopefully we meet again soon, have the day that you deserve. but only you can make it awesome. Bye.